So let's unpack this a little bit more then, because earlier I heard you say that different self-care habits can help me drive revenue in a practice and increase patient outcomes. So talk to me a
Yeah.
little bit about how all that's interconnected. I think that's fascinating.
Yeah. Sounds like a long bridge, but it's really not. So if you show up for your patients and you're fully present, that requires a little bit of work on the front end. You got to work on
Mm.
yourself and not work on yourself like you're not right. You got to make yourself right, but just work on taking care of yourself and your mind, your body with different practices, but so that you can fully be present in the room. And when you're not present, you at least notice it and then you come back to being present. So, because if you're thinking about what you're going to make for dinner when you're trying to tell your patient something, you're going to kind of not really, the message won't really land as well if you're not fully present. So that's a
Mm.
lot of what I teach in addition to the specific communication skills is taking care of yourself and mindfulness, like practicing with your mind to notice your thoughts so you don't get carried away with them when you really should be focused on something else.
So if you've got like these stresses on your mind, like how is it possible for us to show up fully and be fully present for that patient that's in front of us that doesn't really have anything to do with any of the other stresses in our life, and they want to understand their diagnosis and get a high quality level of care? How can, without what you're teaching, like how can that happen? I don't think it can.
Yeah, exactly. So that's what it's kind of like we were talking about earlier. You kind of have to practice to be able to reroute your brain wiring so that you can be more present. Even though that's going on right now, I'm with you, and that's what I'm doing. That's the only thing I'm doing
Mm-hmm.
is talking with my patient, and the patient feels that it's
Mm-hmm.
palpable for them. So they know when you're distracted and that type of thing. And that's not to say I do it perfect every time because some patients will leave and I'll be like, oh, I feel like I didn't really connect with them like I wanted to. But that's just data for next time to do
Sure.
better.